in pulmonary and critical care, I would say that is a place that really shines in terms of Western medicine. Because if someone's having an anaphylactic reaction or severe asthmatic attack and they need to breathe right away, that's not the time to investigate something more holistic. That's where regular medicine shines.
Exactly. So the way I look at conventional medicine, my book is not about throwing away conventional medicine, because, like you said, conventional medicine really shines in acute situations such as trauma, when someone gets a severe infection, someone gets critically ill, like you said, anaphylactic reaction. So it really shines in those areas. So this is not about, throwing away conventional medicine. It's about integrating conventional medicine with a greater paradigm of healing. And speaking of critical care, what I find in the intensive care unit is that a lot of people do come in acutely ill who otherwise had no issues, but most of the patients who come in have been chronically ill for years, and their chronic illness has deteriorated and has created the environment for the critical illness to manifest. So what that points to is that possibly they could have avoided getting to that point if there was a more comprehensive approach to their chronic disease. But certainly conventional medicine is a part of this healing paradigm. It's just that there's a lot more that can be done for chronic disease.
Well, in your book, Healing from the Inside Out, you talk a lot about mindfulness, and you have a chapter with a word that I don't know. It's called mentation. Not meditation, but mentation. Right. Clearing your subconscious blocks and limiting beliefs. Tell us about that.
Right. So mentation is just a pseudonym I use that refers to the mind. And, when we think about the mind, there's the conscious mind and the subconscious mind. And 95% of our behavior is subconscious, meaning that we're not aware of what we're doing. And a lot of it is programmed in our early childhood. And one of the ways how the subconscious behavior can adversely affect us is through something which I refer to as limiting beliefs. And a belief is something you hold as true even if there's no validity to its truth. And limiting beliefs can affect our health, because we have a lot of limiting beliefs around our health. Some examples which I give in my book are, because my parents were chronically ill, I'm bound to get sick. I'm always going to be dependent on medications, and I won't be able to reduce the dosage or the amount. As I age, I'm bound to get ill. There's no one else who can help me but my physician. I mean, these are all limiting beliefs. So a lot of these are programmed by society and the way we're brought up. And what I talk about in that chapter is how to overcome these limiting beliefs around our health. And these limiting beliefs also apply to other aspects of our life, our relationships, our financial status, in other areas as well. So they can affect all areas of our life.
That's true. Now, how about your personal practice? How does that reflect with what you have learned over the course of so many decades of study? Right.
So, unfortunately, not all patients are open to these ideas. It's because of the way what they've been taught and what they believe. So when I see patients, I try to probe to see if they are open to these other ideas. And I do find a lot of them are. Like, for example, as a pulmonologist, I treat a lot of people with asthma. But one of the big factors that leads to worsening in asthma and attacks is stress. And a lot of our stress is also worsened by how we deal with it based on our limiting beliefs, based on our emotional blocks, and those aspects of who we are. So when I do see, and stress causes inflammation, which is a factor in all sorts of illnesses, hypertension, diabetes, heart disease, stroke, other things as well. So when I do, one of the ways which I try to find an in to discuss some of these is by discussing stress. Because everybody's under stress, and it's not the issue of removing the stress, because we can't take ourselves out of modern society for the most part, but it's how we deal with and react to the stress. And a lot of that is programmed in our subconscious mind, like I talked about, and based on our emotional responses. And a lot of our emotional responses are also programmed by traumas that we've had or emotional blocks that we have. So I try to use those aspects as inroads by talking about stress, which is something that everybody can relate to. Everybody can relate to stress.
Yes, that's true. And then how do we deal with it? That's the question.
Exactly. Right. And meditation is a wonderful tool. Where that fits into my healing process is when I talk about flow. One of the aspects of flow is inner flow. And inner flow, my definition of inner flow is a process of getting beyond your thoughts and just feeling your emotions in the moment and not resisting them, and just getting to that place beyond thought and emotion. Because we are greater than our physical bodies, we're greater than our thoughts, we're greater than our emotions. We are something more than that. We have a deeper aspect to who we are. So, and I believe meditation, the practices of meditation and mindfulness are trying to take us to that place. In my book, I refer to that as inner flow. So that's where meditation fits in. But there's a lot of other processes that I discuss in my book around the limiting beliefs and emotional blocks and traumas that are practices that people can institute to cultivate those aspects of who they are and to integrate all those aspects to become whole. Because the definition of healing is to become a whole person, how we were born into this world. And that's where I'm trying to get people.
So true. And I'd like to remind you, listeners, that you're listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and my guest today is physician Dr. Nauman Naeem. We're talking about his book, Healing from the Inside Out. So what about the big issue, well, it is in the United States today, and I believe it is in Canada also, in terms of the very high rate of addiction?
Right. So that's an excellent question, because the opioid epidemic is really prominent in the media these days. I believe that addiction is a response to something within us. And a lot of people become addicted, whether it's substances or whether it's internet or food or whatever it is, because they are trying to numb themselves from some sort of pain or discomfort, usually emotional or subconscious. And until you deal with that subconscious block or that emotional trauma, you're not going to be able to effectively deal with the addiction. And this is where I think our addiction policies fail, not just in the U.S. and Canada, but all over the world. I think Trump just announced a new program to address the opioid epidemic. But the thing that, people don't realize is that you have to get to the inner causes of that addiction. Otherwise, any program or any effort is not going to be successful. And this epidemic is going to persist.
That's true. And where would someone discover that inner voice in order to help themselves if they so desire to move past addictions?
Right. So the thing is that there's practitioners that are out there that are aware of that. Within the realm of psychology and psychotherapy, there's health coaches, there's energy healers, there's people who practice hypnotism and tapping, which is the emotional freedom technique. There's all sorts of different practitioners that are out there that are actually doing wonderful work when it comes to helping people get to those inner causes. But what I would like to see is I would like to see all these different practices as a part of the mainstream and endorsed by the people by the decision makers and the policy makers who truly endorsed so that they can be used by the masses to truly tackle this global epidemic, this global opioid and addiction epidemic that we're facing.
You know, that's so true. And actually, that is my purpose in life right now, where I'm up to, is really seeing things that work and what I would consider good medicine, prudent medicine, evidence-based medicine, all of which is true about the techniques that you're talking about,
right,
being fully integrated into standards of practice of conventional medicine.
Right. Right, and this is my whole mission. Like, I really want to truly create an integrative, a holistic approach that is mainstream, not just on the fringes, not just, reading the occasional book by Deepak Chopra or, watching Dr. Oz now once in a while and seeing these things here and there. I want this to truly be part of the mainstream, and I think that this paradigm shift has to happen because healthcare is in crisis. Whether you want to believe it or not, it is truly in crisis.
Well, thank you so much for being our guest today, Dr. Nauman. What's the best place for people to find you and your book?
So the best place for them to find me is on my website. It's Nauman Naeem, NAUMAN.com. There you can learn more about me. There's links where you can purchase my book from various sources, including Amazon. I have other podcast interviews that I post up there. I have a blog that I do a weekly or a bi-monthly basis, and I also have information on coaching services and other programs that I offer. So I encourage people to visit my website to learn more.
And thank you, listeners, for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email whpc@ncc.edu. This is your host, Ellen Kamhi, at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.